House Republicans and House Democrats here in Mississippi finally on the same page about expanding Medicaid. Democrats say they are excited about this potential change. Mississippi remains 10 out of the 50 states that has yet to expand Medicaid.
Given a chance to support a bill that has the work requirement to get Medicaid expansion done here in the state of Mississippi, as the House Democrats, we would support those efforts.
Democrats gathered in the Capitol's rotunda Tuesday showing their support for the bill. But House Minority Leader Robert Johnson says the work requirement put in place in order to receive government-funded health care should be removed.
CMS has not, and they've told us they will not approve a work requirement. They want straight Medicaid. We know that most of the people that we're going to cover are working people anyway.
In the past, the Centers for Medicare and Medicaid Services has denied almost every Medicaid expansion application that has a work requirement. One application is still in litigation. State Rep. Darrell Porter Jr. said there is a provision in the bill saying if the work requirement is not approved, then the bill itself would still go into effect. It would just take longer. Democrats say this requirement should be taken out so Mississippians can receive Medicaid sooner.
I think that we're going for Medicaid expansion now because our health care system is in a state of crisis, has been in a state of crisis, and we've seen that play out in this last gubernatorial race as well. I mean, we literally have people that are dying on the side of the road because they don't have access to hospitals are closing.
Governor Tate Reeves taking to Facebook this morning saying the Biden team is overjoyed with what some in Mississippi are planning right now. Count me amongst those extreme MAGA Republicans who think government should not run health care.
It doesn't matter whether you're Republican or Democrat. It doesn't matter where you live. You're being affected negatively. It's hurting your communities. You can't attract jobs. You can't keep people living there. So, it does. I don't know where the governor sees things going, but the people in this legislature know that if we don't do something, their communities are gonna die, and they're gonna have people all over the state who don't have places to go to get health care.
State Rep. Johnson said he believes leadership in both houses are prepared for Governor Tate Reeves' anticipated response to the bill. Brooklyn Journal reporting from Jackson, 16 WAPT News.